All right, welcome back. You see Dr. Craig Walker. You also see Frank Lagarde, Jr., who was a PAD patient. And Dr. Walker's been taking us through all of the symptoms and what they do for PAD on this Awareness Month. Dr. Walker, the symptoms of PAD and the warning signs again. In a nutshell, what would they be?
Well, of warning signs to the patient, first would be cramping in any muscle when they walk. First and biggest symptom. That's called claudication. Understand most people with PAD, though, have no symptoms at all, or they think that they simply have arthritis because their pain doesn't present in a normal way. Now, that patient can still be diagnosed as simply as one's doctor putting a finger on a pulse. If you don't have a pulse in your foot, you've got PAD. It's real simple. That's not a tough thing, and I tell people that they should always have their feet examined when they see a physician. I think it's a very, very important part of a physical exam. Now, on the far end of the spectrum, we have ischemic ulceration and gangrene. Now, that's bad. You don't want to get to that point, and you have rest pain. Those are called critical limb ischemia. Once you get to that point, if nothing is done to restore flow, 70% of those people will lose their limb within 6 months. So it's very important to pick this up early, and typically the disease patterns are different. Typically pain when you walk and nothing else is more involvement of the superficial femoral artery and the profunda, the arteries between the hip and the knee. Yeah. Typically, people lose their legs when they develop blockages in the arteries at the knee and below. Those seem to be more a cause of limb loss. And the three things this is most closely related to are advanced age, diabetes, and cigarette smoking. Now, in America, the fastest growing segment of our population is octogenarians, people more than 80 years old. So we have an advanced age population, and we should expect this is going to be a big problem. Secondly, diabetes is rampant. With obesity going on in America, it's estimated that if present trends continue, by the year 2020, as much as 50% of the adult U.S. population will either be overtly diabetic or at least chemically diabetic. So these are big numbers. Luckily, smoking has decreased in America, but not the rest of the world. So I think it's wise for us to realize that we probably have an epidemic of peripheral arterial disease that's not about ready to go away. In fact, it is probably going to grow further from this point. That's not even mentioning, in all the statistics, no one sums in the Hispanics. Hispanics have a higher rate of peripheral arterial disease and of amputations, and they're the fastest growing segment of the United States population.
Why would that be?
Probably genetic, much higher rates of diabetes, cholesterol abnormalities, but again, very high rates of amputation. Probably something to do with that, along with the diabetes. Diabetes and diet are interlinked quite a bit.
Okay. Now, Frank, let me ask you. He said all these things. Did you smoke?
Never smoked in my life.
Did you have diabetes or anything?
No.
So how the heck did you get where you are? Was it hereditary?
Well, a combination, I think, what Dr. Walker was saying before is I had this blood clot that broke loose and ended up behind my knee. And that's probably what caused the pain that led me to believe I pulled a muscle first time.
And I guess the reason I'm asking, so people watching tonight that may not be smoking, may not have diabetes, that don't mean they don't need to get checked, right?
By the way, this 27-year-old who was 21 when she had her bypasses was neither a smoker or diabetic.
It's pretty scary when you think about it.
It is, and there are other causes. The overwhelming majority of causes of atherosclerosis, of blockage, is atherosclerosis, which is typically a disease as we get older. But we have other problems. Arteritis can do it. Aneurysms can do it. Spontaneous dissection of the vessel, where a vessel simply splits inside of itself, predisposing to problems. Vascular spasm can do it, particularly something we worry about in people using cocaine, because that can cause intense spasm. Right. So there are a whole host of causes, most common of which is atherosclerosis. The most common thing that also causes blockages in the heart and the carotids. However, It's not the only cause, and anything that plugs up the circulation going to your legs and denies leg muscles and bones and those things the blood supply that it needs to stay alive is a big problem.
Frank, let me ask you, are you active today? How active are you?
I'm probably back about 70% active, doing what I do before. I've been fishing numerous times since, in fact, I fished the weekend after Dr. Operated on me, Dr. Walker, the first time in December. A week later, I was on my boat at the mouth of the river fishing with my kids.
Were you as lucky in the boat as you were? We getting your procedure?
Yes, we were. In fact, I had my 4-year-old grandson, and he caught his first saltwater fish, and I'll send you a picture of it. It's about a 12-pound redfish.
So that was a good week for you.
Oh, if you have grandkids, you know the smile when you see it. He was in heaven. But I have a farm. I'm not supposed to do this, but I cut firewood with a chainsaw, which all my doctors said I can never do that again. But I've ordered the Kevlar pants. I got the helmet.
Did Dr. Walker tell you not
Yes,
to do that?
Yes, he did. Oh, yeah. He told me there's activities I have to watch.
Yeah. And you're sitting there on TV 2 feet away from him telling him that you do it?
But, we have a cabin. We need firewood to heat the cabin. It's a wonderful place, a getaway place in the country. My kids didn't want me to build it, but I can't get rid of them. They're always up there.
Right.
But I'm doing pretty much everything. My calf is still weak from where I had the dead, infected muscle pulled out. But I forgot to tell Dr. Walker this today when he examined me. For the first time, when I walk a lot, I can feel that muscle moving. I've never felt it since October of 2010, when most of my calf muscle was removed. For the first time, I can feel it being exercised and moving. I'm getting my feeling back gradually there. And
this is the first time we had a consultation happening right here on the air.
It's interesting. When Frank went in the first time and had his surgery, his ischemia had been so bad that the muscle was dead, and they have to remove that when that's the case, because if you don't, it will poison the bloodstream. That muscle breaks down, and the byproducts go in and they kill your kidneys. There are a lot of other things that happen.
I never knew that.
So they'd remove some of the tissue when they did his bypass, and I think it was a wise thing. Right now he's not having pains when he walks or anything. It's just he's got to still build up more muscle before he can do everything. But I remember Frank's thing, Doc, if only I could get out to do some fishing. He said, I would sure love to be able to take my grandson fishing. And I got an email from him that weekend with a picture of his grandson and a 12-pound redfish. He says, we did it.
That's the way it ought to work, huh?
I could not ride in a boat before this intervention. It was that bad.
If your grandson ever needs a tractor, you can talk to Dr. Walker's son.
Well, we have 3 tractors, and he knows all about John Deere and Kubota. So James and Jack are going to get together one day.
I appreciate you coming by as the patient, and certainly as the doctor. We always have Dr. Walker on. But so PAD Awareness Month, it's important to keep educating the public, isn't it?
It is. We've started an initiative called My Leg, My Choice. It actually started here. It's expanding around the country. I encourage people to come as we have meetings. We will keep this posted on the internet. This is very important, and we have to get this message out. There's a lot more that can be done in this field. It's tremendously important. It represents an area of major importance for our patients, and I'm very pleased to see that so much change has happened in this area.
All right, Frank, thanks again for coming by. Don't get stuck in traffic on the way back.
My pleasure.
And Dr. Walker always. Thank you very much.
Thank you, Mark.
All right, we're going to take a break. When we come back, we have Houma Police on the line to give us some information, and then the phone lines are open, 879-1231, and more guests to come. It's all next. Don't go away.